We've got a health alert for you. The FDA now says that future COVID boosters will not be routinely approved for healthy young adults and children. The agency says that the shot will still be offered to people 65 and over, as well as those deemed high risk. It's important to note this only applies to future COVID shots, and that anyone who wants to get a shot currently on the market can still do so. Epidemiologist and ABC's medical contributor John Brownstein joins us now with more. So, John, first break this down for us. Are they prohibiting you if you're 40 years old and you want to get a COVID shot from getting one, or how does this work?
Well, Terry, it's important to note that the FDA is not changing access for the existing COVID vaccines. Those remain available to everyone. What they are changing is the requirement for more robust trial data for those that are healthy under the age of 65 before approving future COVID vaccine updates. That is different from before, where we actually looked at immune comparisons, not placebo-controlled trials, to get speedier delivery of new vaccines when we have new variants emerging. So this is a big deal because it may reduce access, might confuse the public, and it leaves open the idea that people will not be covered by insurance if they are under the age of 65 or don't have underlying conditions. And so it is going to create a lot of confusion. FDA argues that this is aligning with science and providing benefit for those that are in high risk groups, but not necessarily getting that same benefit for low risk. But I do think, the challenge is, what is future access going to look like for the population, especially for those who want this vaccine?
Got it. So it sounds like the FDA, under the leadership of the Secretary of Health and Human Services, Robert F. Kennedy Jr., wants more testing on the impact of these vaccines, potential impacts, negative impacts on younger people in their 40s and 50s. What's the evidence that, there are obviously reactions in every vaccine for some people, but what's the evidence around that you're aware of?
Well, I think we know that the vaccines that work, they're the most tested vaccines ever created, and we know that updating vaccines against future variants is critical. Now, we have to remember, yes, high-risk groups are those over the age of 65 and that are immunocompromised, but remember, we have caregivers, we have contacts of high-risk groups. So if we take those out of the equation, that creates risk for those that are vulnerable. And we know that community protection matters. So you reduce community protection, then you're not creating that benefit to those that are high risk. And so while we are trying to prioritize people that are high risk, it depends on getting that vaccine to people around them. And that is a big risk in the coming season with the updated vaccine.
Yeah, that's a great point. It's a significant shift then, it sounds like, Dr. Brownstein. Thank you very much, as always, for helping us understand it.